Have you ever noticed that after a poor night's sleep, everything feels harder? Your thoughts are slower, your body feels heavier, and even simple decisions take more effort. Many people assume that sleep difficulties are a normal part of aging, but research tells us otherwise. In fact, regularly getting less than 6 hours of sleep per night can have profound effects on nearly every system in your body, from cognitive function and heart health to immune response and metabolism. Sleep is not just a passive state of rest, it is an active and essential biological process. During sleep, the brain undergoes a process called glymphatic clearance, where cerebrospinal fluid flushes out metabolic waste, including beta amyloid, a protein associated with Alzheimer's disease. When sleep is consistently cut short, this waste accumulates, leading to an increased risk of neurodegenerative disorders. Studies published in Neurology and Nature Communications have demonstrated a strong correlation between chronic sleep deprivation and cognitive decline, including memory loss, reduced processing speed, and impaired problem-solving skills. But cognitive decline is only one consequence of insufficient sleep. Cardiovascular health is also directly impacted. Research from the American Heart Association indicates that individuals who sleep less than 6 hours per night have a significantly higher risk of developing hypertension, arterial stiffness, and coronary artery disease. This is because sleep plays a crucial role in regulating blood pressure and heart rate variability. When sleep is inadequate, the autonomic nervous system remains in a heightened state of sympathetic activity, leading to increased stress hormone production, such as cortisol, which raises blood pressure and contributes to inflammation within the arterial walls. Inflammation is a key factor in many age-related diseases, and insufficient sleep is one of the most overlooked contributors. Chronic low-grade inflammation has been linked to conditions such as type 2 diabetes, osteoporosis, and even certain cancers. A study in the Journal of Clinical Endocrinology and Metabolism found that individuals with restricted sleep exhibit elevated levels of pro-inflammatory cytokines, such as interleukin-6 and tumor necrosis factor alpha, which can accelerate cellular aging and increase disease susceptibility. Additionally, the immune system is heavily dependent on adequate sleep. During deep sleep stages, the body produces and releases cytokines, which are critical for immune signaling and defense against infections. Research from the University of California, San Francisco, found that individuals sleeping fewer than 6 hours per night were over 4 times more likely to catch the common cold compared to those who slept at least 7 hours. This is because sleep deprivation reduces the proliferation of T cells, which are responsible for targeting infected cells, while simultaneously increasing inflammatory markers that suppress immune efficiency. Beyond immune health, metabolism and weight regulation are also profoundly affected by sleep duration. Sleep deprivation alters the balance of 2 key hunger-regulating hormones: ghrelin, which stimulates appetite, and leptin, which signals satiety. When sleep is insufficient, ghrelin levels rise while leptin decreases, leading to increased hunger and cravings for calorie-dense foods. A landmark study published in the Annals of Internal Medicine demonstrated that individuals who slept 5 hours or less per night had a 15% reduction in fat metabolism compared to those who had sufficient rest. Additionally, sleep loss disrupts insulin sensitivity, increasing the risk of metabolic syndrome and type 2 diabetes. These physiological consequences illustrate why chronic sleep deprivation should not be dismissed as a minor inconvenience. It is a significant risk factor for multiple health conditions and can accelerate biological aging at a cellular level. However, the good news is that sleep quality can be improved with targeted interventions, and even small adjustments to nighttime routines can yield substantial benefits. The next section will explore scientifically proven methods to enhance sleep efficiency, regulate circadian rhythms, and optimize overall health through improved rest. Understanding the consequences of sleep deprivation is one thing, but improving sleep quality requires a targeted, science-backed approach. Fortunately, circadian rhythm regulation, sleep hygiene optimization, and biochemical support can significantly enhance both the quantity and quality of sleep. At the core of sleep regulation is the circadian rhythm, a 24-hour biological clock governed by the suprachiasmatic nucleus, SCN, in the hypothalamus. This internal clock responds primarily to light exposure, temperature changes, and hormonal fluctuations. When properly aligned, it promotes optimal sleep efficiency. However, as we age, the circadian system becomes more fragile, making it easier for external factors to disrupt sleep patterns. One of the most overlooked culprits of sleep disruption is evening exposure to artificial blue light. Blue wavelengths, emitted by LED screens and electronic devices, suppress the production of melatonin, a hormone critical for initiating and maintaining sleep. A study in the Journal of Pineal Research found that exposure to blue light within 2 hours of bedtime reduced melatonin levels by up to 85%, delaying sleep onset and reducing sleep depth. To counteract this, it's essential to minimize screen exposure in the evening or utilize blue light blocking glasses to preserve melatonin secretion. In addition to light regulation, temperature plays a key role in sleep efficiency. The body's core temperature naturally drops by about 1 to 2 degrees Fahrenheit as part of the sleep cycle, signaling the brain to transition into deep sleep. Research from the National Sleep Foundation suggests that an optimal bedroom temperature for sleep is between 60 to 67 degrees Fahrenheit, 15 to 19 degrees Celsius. If the environment is too warm, it can interfere with this thermoregulatory process, leading to frequent awakenings and fragmented sleep cycles. Cooling strategies, such as breathable bedding and lower room temperatures, can significantly enhance sleep stability. Another critical factor is cortisol regulation. Cortisol, commonly known as the stress hormone, follows a natural diurnal pattern, rising in the morning to promote wakefulness and declining in the evening to allow for rest. However, chronic stress or inconsistent sleep schedules can disrupt this cycle, leading to elevated nighttime cortisol levels, which impair sleep onset and quality. A study in psychoneuroendocrinology found that individuals with dysregulated cortisol rhythms experienced up to a 50% reduction in deep sleep. Practices like meditative breathing, progressive muscle relaxation, and evening exposure to dim, warm lighting can support cortisol reduction and enhance sleep readiness. Beyond environmental factors, nutritional biochemistry plays a significant role in sleep health. Certain nutrients act as precursors for neurotransmitters involved in sleep regulation. Magnesium, for instance, is essential for the activation of gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter that promotes relaxation. A randomized controlled trial in the Journal of Research in Medical Sciences found that magnesium supplementation improved sleep efficiency and reduced nighttime awakenings in older adults. Foods rich in magnesium, such as spinach, almonds, and pumpkin seeds, can naturally support sleep quality. Likewise, tryptophan, an amino acid found in turkey, dairy, and nuts, serves as a precursor for serotonin and melatonin synthesis. Clinical studies have demonstrated that increased dietary tryptophan intake can improve sleep onset latency and overall sleep architecture. Consuming small amounts of protein-rich foods in the evening may facilitate natural melatonin production and promote deeper sleep cycles. In addition to dietary strategies, movement patterns throughout the day influence sleep depth. Regular physical activity, particularly in the morning or early afternoon, enhances sleep quality by increasing adenosine accumulation. a neurochemical that builds sleep pressure. A systematic review in sports medicine found that older adults who engaged in moderate intensity exercise at least 3 times per week experienced a 67% reduction in sleep disturbances compared to sedentary individuals. However, vigorous exercise too close to bedtime can elevate core body temperature and delay sleep onset, so it's best to schedule workouts earlier in the day. Another critical consideration is sleep architecture, the natural progression through the different sleep stages, including deep sleep, slow-wave sleep, and REM sleep. Deep sleep is essential for cellular repair, immune function, and memory consolidation. Unfortunately, aging is associated with a gradual decline in deep sleep duration, making it crucial to optimize sleep-promoting behaviors. One effective method is controlled light exposure in the morning. Natural sunlight exposure within 30 minutes of waking helps regulate melatonin production for the following night. Improving sleep quality is not about a single intervention. It requires a multifaceted approach that aligns with the body's biological rhythms. By adjusting environmental factors, managing stress hormones, optimizing nutrition, and maintaining consistent activity patterns, individuals can significantly enhance their sleep efficiency and long-term health. The next section will discuss common sleep disorders that become more prevalent with age, including insomnia, sleep apnea, and restless leg syndrome, as well as evidence-based interventions to address them. Even with the best sleep hygiene practices, some individuals still struggle with poor sleep quality due to underlying sleep disorders that become more prevalent with age. These disorders not only disrupt sleep, but also contribute to cardiovascular disease, metabolic dysfunction, and cognitive decline. Identifying and addressing these conditions is essential for maintaining long-term health and well-being. One of the most common sleep disorders affecting older adults is insomnia, characterized by difficulty falling asleep, staying asleep, or waking up too early. While occasional sleep disturbances are normal, chronic insomnia is associated with increased inflammation, impaired glucose metabolism, and a higher risk of neurodegenerative diseases such as Alzheimer's. A study published in Neurology found that individuals with persistent insomnia had a 30% faster rate of brain atrophy in regions associated with memory and cognitive function. The primary drivers of insomnia in older adults include changes in circadian rhythm, decreased melatonin production, and heightened stress reactivity. While pharmaceutical sleep aids, such as benzodiazepines and sedative hypnotics, are often prescribed, they come with significant risks, including dependency, cognitive impairment, and an increased likelihood of falls. Instead, cognitive behavioral therapy for insomnia, CBTI, has been shown to be more effective in long-term sleep improvement. A meta-analysis in JAMA Internal Medicine reported that CBTI improved sleep efficiency by 19% and reduced nighttime awakenings by 55% compared to medication. Techniques such as stimulus control, associating the bed only with sleep, sleep restriction, limiting time in bed to consolidate sleep, and relaxation training, progressive muscle relaxation, and guided imagery are core components of this approach. Beyond insomnia, another critical but often undiagnosed sleep disorder is obstructive sleep apnea, OSA. OSA occurs when the airway becomes partially or completely blocked during sleep, leading to repeated episodes of oxygen deprivation and microarousals throughout the night. This results in excessive daytime fatigue, impaired concentration, and an increased risk of hypertension, stroke, and heart failure. A study in The Lancet Respiratory Medicine found that untreated sleep apnea is associated with a 140% higher risk of cardiovascular mortality. One of the hallmark signs of sleep apnea is loud snoring, gasping for air during sleep, and morning headaches. The gold standard for diagnosis is a polysomnography sleep study, which measures respiratory effort, oxygen levels, and sleep cycles. Treatment options include continuous positive airway pressure, CPAP therapy, oral appliances that reposition the jaw, and lifestyle modifications such as weight management and positional therapy. Emerging research suggests that myofunctional therapy, exercises that strengthen the tongue and airway muscles, can reduce apnea severity by 50%. Another disruptive condition is restless leg syndrome, RLS, a neurological disorder that causes uncomfortable sensations in the legs, leading to an irresistible urge to move. Symptoms typically worsen in the evening and can severely impair sleep onset. RLS is strongly linked to iron deficiency, as low iron levels impair dopamine function, a neurotransmitter involved in motor control. A study in Sleep Medicine Reviews found that iron supplementation improved RLS symptoms in 67% of patients. Magnesium, which regulates neuromuscular function, has also been shown to alleviate symptoms. Beyond sleep disorders, one emerging area of research focuses on the gut-brain connection and its impact on sleep quality. The gut microbiome, the diverse community of bacteria in the digestive tract, plays a crucial role in regulating sleep-related neurotransmitters, including serotonin, GABA, and melatonin. A study in Nature Communications found that individuals with a higher diversity of gut bacteria had more stable sleep patterns and longer deep sleep durations. Consuming prebiotic-rich foods, such as garlic, onions, and bananas, and probiotic sources, such as yogurt and fermented foods, can support microbiome diversity and enhance sleep regulation. Another key factor in age-related sleep disturbances is hormonal decline. As people age, levels of growth hormone and testosterone decrease, leading to reduced sleep efficiency and increased nighttime awakenings. While hormone replacement therapy, HRT, may be an option for some individuals, natural strategies such as strength training, intermittent fasting, and exposure to morning sunlight can naturally boost these hormones and improve sleep quality. In addition to these biological factors, psychological and social influences play a critical role in sleep health. Loneliness and social isolation, common among older adults, are strongly correlated with higher levels of nighttime cortisol and disrupted sleep architecture. A longitudinal study in psychosomatic medicine found that socially active individuals had a 40% lower risk of developing chronic insomnia compared to those with limited social interactions. Engaging in community activities, maintaining strong personal relationships, and practicing mindfulness-based stress reduction, MBSR, can significantly improve sleep outcomes. Ultimately, optimizing sleep requires a comprehensive, personalized approach. From circadian rhythm alignment and sleep hygiene optimization to addressing underlying sleep disorders and leveraging nutritional and lifestyle interventions, every aspect plays a crucial role in enhancing sleep quality and overall health. By making intentional changes, individuals can protect cognitive function, reduce disease risk, and enhance longevity. The science is clear. Sleep is not a passive state, but an active, regenerative process that determines long-term well-being. Whether it's through improving sleep habits, seeking medical evaluation for sleep disorders, or incorporating targeted nutritional and lifestyle strategies, the path to better sleep and a longer, healthier life is within reach. Now, it's time to take action. If you found this information valuable, be sure to like, comment, and subscribe for more science-backed strategies on aging, longevity, and well-being. Let's make every night a step toward a healthier future.